Hi, my name's Dr. Rangi De Silva. I'm an obstetrician and gynaecologist, and I'm going to be talking to you today about endometriosis. You may have heard a lot about endometriosis. It's gained a lot of public attention, which it should rightfully have. It's a very common condition that affects many women of all ages, but particularly women of reproductive age. It's an inflammatory condition that can affect many parts of your body, but mostly in your pelvis and your reproductive organs. And it's basically where the lining of the uterus or tissues that are similar to the lining of the uterus or the endometrium are found outside of the uterus or the womb. They're not really meant to be there, so they can cause inflammation and pain. And that is the main symptom that people might get in endometriosis. Pain with their periods, pain with intimacy, pain with going to the toilet, either urinating or opening your bowels, or just pain all the time, unfortunately. So it can be quite a debilitating condition. It can also be associated with heavy periods, and sometimes it can be associated with having trouble getting pregnant. Sometimes you might find that people have a family history, so mothers, sisters, cousins might have it. But the most important thing is that you seek medical attention if you've got any of these symptoms, because you shouldn't be having to put up with pain. The main ways we might diagnose endometriosis are through talking to you and gaining a thorough history, and that would give us a strong suspicion that this might be the case. We might go on to order some investigations like an ultrasound of the pelvis, and that's one of the main tools we currently have. Ultrasounds aren't 100% accurate at diagnosing endometriosis. They can diagnose moderate to severe endometriosis pretty well, but they're not great at diagnosing what we call mild endometriosis or endometriosis on the surface levels of the organs. Sometimes to diagnose that, we might use the help of things like an MRI, but they can be hard to access and a bit expensive. It's important that ultrasounds are done by experienced people that are used to looking for endometriosis so that we can maximise our chances of finding it. If we don't find it on ultrasound, or we do, then sometimes we can organise surgery to have a look inside your pelvis. And that's usually keyhole surgery, or what we call laparoscopic surgery. And if we can see endometriosis that's safe to remove, so that is not involving vital organs or blood vessels that we worry about damaging, then we would usually take it out and send that sample off to get tested to make sure it is actually endometriosis. Sometimes we do take out that severe endometriosis as long as we carefully plan that surgery with you and with the right surgeons. The other way we can treat endometriosis other than taking it out is to suppress the endometriosis with hormones. Because the tissues involved in endometriosis are either the same or similar to the endometrial tissues or the lining of the womb, we know that they're receptive to hormones and they can be suppressed with the right hormonal combination. So something that we often recommend with or without surgery is hormonal suppression, and that can be in the form of oral tablets like the pill or progesterone-only pills. It can be in the form of implants like an Implanon in your arm, or it can be in the form of an IUD such as a Mirena or a Kylena that go inside the uterus. Some are longer term, some are shorter term. They all have some potential side effects, but not for everyone. And it's really about finding the right treatment plan for you. Another way we treat endometriosis with all of the things that we've just talked about is the holistic way of pelvic floor physiotherapy, because that can really assist with any pain that you may have with endometriosis, as well as things like an anti-inflammatory diet, regular exercise, and psychosocial support, because living with chronic pain or pain at any time can be really stressful and can affect your mental health. So the way we treat endometriosis and diagnose it is really holistic and patient-centred. But the most important thing is that you should seek medical attention.